If you're going to treat musculoskeletal problems, you need to have a specialist who's familiar with those problems. I spent 4 years of intensive training learning about every joint in the body, learning about all the afflictions of the joints, and learning how to approach them surgically. So that background, I think, gives me a distinct advantage over most everyone else in this field. I mean, if you have an anesthesiologist or you have a family practitioner or a physiatrist, they don't have the nuances of how to treat injuries like this. They've never been in an OR setting. They don't really know what's proper and what's not. I can wear two hats. I can wear the hat as an orthopedic surgeon. I can wear the hat of a regenerative medicine doctor. My experience with stem cell cases dates back for about 12 years now. I've done thousands of cases, and I use my knowledge as an orthopedic surgeon to expand upon this, and I'm always looking to push the envelope, always looking for the next cutting edge of the cutting edge. So my experience is hips, knees, shoulders, spine, you name it. If it's orthopedic, I treat it. Well, to say what kind of treatment I've done and what kind of things I've done is basically to say what's involved in orthopedics. Orthopedics is the specialty that involves the extremities and the spine. So if it's part of the extremities or it's part of the spine, I have taken care of it. But let me take it one step further. I also deal with some autoimmune diseases such as rheumatoid arthritis and things like that, where we'll give the V cells to. I'm also very interested in anti-aging medicine because stem cells and aging go hand in hand with the immune system. So I have to kind of learn about those things also. So we're dealing with all those things. So bottom line is, if it's in the extremities, if it's in the spine, if it's in the anti-aging field or autoimmune field, I treat it. You know, a question people say is, well, you think it's good to use my own stem cells since they may be old. Well, all well and good. You may hear these stories from other entities saying you don't want to use your own stem cells because they're old. You want to use the stem cells from the placenta tissue, from the cord blood, from the amniotic tissue. There's one big problem with that. The FDA does not allow live cells in those products. So you're only getting growth factors only. There's nothing like your own cells. The other good news about using your own cells, there's no chance of an allergic reaction. These other entities always have the potential of causing an allergic reaction. They are not what we call immune privilege, meaning immune privilege means it can be used in anyone. They're what we call immune evasive. They kind of fool the body for a while, but eventually the body catches up with them. There's nothing as good as your own cells. The type of stem cells that we use sort of depends somewhat on the patient's condition. The minimum that we'll use is what we call a PRP, which are the growth factors from the blood, and fat, which has some purposes of cushioning the joint and supporting the joint, but it also has some stem cells in it also. Now, if I have a joint that's bone-on-bone arthritis or something, then I'm going to basically go to the ultimate. I'm going to use cells from the bone marrow, cells from the fat, and cells from the PRP, and I'm going to follow that up with a couple of booster injections of cells from the PRP and growth factors from the PRP. So people ask me, okay, so you're not much different than the guy down the street in that he's going to also use my bone marrow and my fat and my blood. Yes, but there's a lot of different things. We also are going to maybe use shockwave therapy. It's called extracorporeal shockwave therapy, which is more like a jackhammer. It's nothing to do really with electricity. That's something most people don't have access to. More importantly, we'll have access to growth factors. You know, stem cells, and the reason why we get into trouble with stem cells and treatments is our stem cells don't necessarily make the right growth factors. We enhance this by using patches with growth factors. The most unique process around. There's only 2 or 3 places in the whole world where these are available, and these are places that I work at. Look at the science, look at the science, look at the science. I read and read and read. Then I bounce it off some people I very much trust. There's basically 2 or 3 people in this field that I trust implicitly, and I say, what's your thoughts on it? And then we kind of tackle the problem and try and develop a program. Well, you should choose me if you want to have the best possible result. I mean, there's no guarantees. I may do you and you still may not get better, but I can pretty well tell you, I think I'm going to give you a better chance of getting better than the average guy out there. I don't dabble in this. I devote myself fully to it. I work in my office every day, except weekends. But on weekends, I'm reading and I'm studying. I'm preparing for lectures that I'm going to give to other doctors. So I'm always trying to, again, be on the cutting edge of the cutting edge. I don't think these other people can say it. They're followers. I'm a leader. Well, for a lot of them, they think it's a very easy field and a lucrative field for them. Unfortunately, I think they've put the well-being of the patient in the back seat. Their knowledge of stem cells is really limited. Again, I see this all the time and I just shake my head. But like I say, it's a field for them. They think it's an easy thing to do. This is a very hard field. If you're going to do it and do it right, it's going to take many years to learn, and you have to always keep wanting to learn. You don't want to just do something that's very simple. I've always, ever since I've been a resident, been interested in the cutting edge. I get bored. I guess I have some ADD. I've always known that ever since I was a child, and things bore me. But this is a field that doesn't bore me because there's always something new right around the corner, something that's intriguing, something that I think I can make better. You know, like I say, now I'm getting really involved in anti-aging. I think we're going to make some tremendous differences in that, and it's going to make a difference and a mark on the world. In some respects, stem cells are too good to be true. The problem that we've run into stem cells, and I have a saying when I tell people, I said, if you see a website that's treating everything, that means they're treating nothing, okay? As far as stem cells are concerned, we've probably made more strides in the field of musculoskeletal conditions than anything else. But when you start treating Parkinson's, or you start treating Alzheimer's or ALS, I'm not so sure the promise is there yet. I think there is some good benefits that can be attained down the road, but we're not there yet. So the promise is there, but it's not necessarily yet attainable. Well, this is a very simple thing, and I'd like to get a little technical on this. To register these products with the FDA is a very easy application. It's called a 361. But what they're doing is they're registering only as a tissue product. The FDA is okay with that. But the FDA is very specific, saying that if your tissue product by some chance contains live cells that have metabolic activity, this is no longer a 361. It's now classified as what they call a 351. A 351 requires what they call an investigational new drug application, meaning that it has to undergo clinical research, clinical trials, and many years of evaluation. Then it may be approved by the FDA. So if someone is saying that they're giving live cells with these products, they basically, it's one of two things. Either the doctor has been hoodwinked by a slick salesman, or the doctor's dishonest. I'm hoping he's been hoodwinked. The minimum qualification should be, you need to be qualified first. I'm board certified in orthopedic surgery. I know joints in and out, forward and backwards. Like I say, orthopedics is a study of the spine and the extremities. You would not have to have a doctor, nor want a doctor, treating you who's not really specialized in training of those entities. All these other physicians may have had bits and pieces of it in their training, but not 4 years straight of it like I have. So to me, right off the bat, you need to be an orthopedic surgeon to be proficient in these things, and then you need to know stem cells. So you need to wear two hats, regenerative medicine and stem cells. So you need to ask the doctor, basically, what are your qualifications? How long have you been doing this? How many cases have been done? Am I going to have a doctor who's going to inject me, or is it going to be a nurse practitioner? Are you going to use imaging, either a fluoroscope or an ultrasound or both? Is it going to be done the proper way? What cells are you going to use? How are you going to use them? Stem cell therapy, I think, is the answer to most diseases, answer to anti-aging. If I can kind of increase my quality of life, you know, we can live longer, but if we can't live longer with a good quality of life, then it's not worth living. So I think there's a lot of things that we're going to do. It's going to revolutionize medicine. It's already doing that, and it's just going to continue. The genie is out of the bottle, and luckily it's going to stay out of the bottle.